Hi, we're at the Palm Beach Cancer Institute, and we're here in Wellington, Florida with Dr. Gersten, and I want you to tell us a little bit about how long have you been practicing here at this cancer center?
I've been here for about 8 years, closing in on that in July with the Palm Beach Cancer Institute. Previous to that, I had trained at Moffitt Cancer Center over in Tampa for the previous 3 years.
Okay, great. And our story is basically set about two young ladies that have cancer, and what are they going through right now?
Well, both of them actually have active cancer right now, and they're both on treatment for it. The real gist of the whole situation here, and the reason we did a story today, was I wanted to address the topic of young adults with cancer. Okay. And these are older teenagers and adults under the age of 40 who have cancer. And it's really a group that doesn't get too much attention. Usually the group that gets attention are the pediatrics and the older groups, but I wanted to focus on this group for a change.
That's nice. I mean, how common is it for this age group to have cancer?
It's about 72,000 new cases a year in that older teenage and adult population. And in fact, about 1 in every 8 minutes, someone in that age group is diagnosed with cancer across the United States.
I mean, that's a scary fact for any age group. For someone that wants to know about what are the preventative measures that we can do? Is there something we can do?
You know, unfortunately, a lot of cancers in this age group are just genetically based. They're not inherited per se. Some are, but the vast majority are not. They're what we call sporadic tumors. They just happen, and there's nothing you could really do with your lifestyle. It just strikes, and then you have to deal with it.
Is it true that diet, exercise, all those good things that we're told not to have stress, do those really help?
Probably not. I mean, the one particular case, the one thing we can look at in the case of one of the patients here today is the issue of scorching sunburns during childhood and protection from the sun.
Oh, wow.
So we do have a patient here who has melanoma, and that has been linked to severe sunburns during childhood. So that's a risk factor for that. So that obviously protective lotions with the appropriate SPF are important there. But other than that, the usual measures in terms of smoking prevention and other things are not really helpful in this age group.
Now, for people out there that maybe want to support the cause to help cancer research, what can we do?
There's actually a website called Stupid Cancer that's specifically for this age group, older teenagers and young adults that people can go to and make donations, and they have their own philanthropy that supports them.
That's wonderful. So I think what's great is that we're getting the word out and that we want people to be aware of what's going on, and check out stupidcancer.com.
I believe that's what it is, yeah.
Great. Thank you so much.
Yep.
We're sitting down here with Krista, and she's one of our cover girls for the edition for Bonsai Wellness Magazine, and she wants to tell us a little bit about your story. Do you mind sharing with us?
Sure. I guess I can start with my diagnosis.
Okay, that would be great.
Is melanoma cancer that metastasized. They never found the primary target on the outside of my skin.
Really?
And but we discovered it on November 13th when I was 9 months pregnant, and I wasn't able to breathe. So I called my doctor, and they sent me immediately to the emergency room, and they thought that maybe I would have had a blood clot.
Okay.
Because, being 9 months pregnant. And so when they did the MRI, they found not a blood clot, but a mass in my lung. And so then I had an emergency C-section.
Okay.
And thank God I have a 5-month-old beautiful baby boy. That's perfect.
Good.
And then they had to do some testing, and when they finally found out the testing, it was melanoma that had metastasized. And so in January, I had it removed.
Okay.
Because at that time, that was the only area that they found.
Yeah.
So we had it removed in January, and then probably less than 6 weeks later, it had continued, and they found it in my brain on March 6th. So I've been doing treatment ever since, and thankfully, when they did test it, I guess tested positive for what's called the BRAF gene mutation, which there is an amazing drug that's called Zelboraf that attacks that mutation specifically. So I had about 15 bouts of radiation, and then after the radiation, I've been on the drug ever since.
How are you feeling today?
Good. I feel good.
Good.
Lots of, I never say lots of energy, but considering all the things that I've been through, it's like,
Do you look at life differently now that you've been through all this?
Oh my gosh, unbelievable. It's totally different. I mean, it may sound so weird, but this has been an amazing journey. And I mean, I'm actually
You just gave me goosebumps when you said that.
It's been an amazing journey. I'm actually thankful that this has happened, believe it or not. I mean, our lives have changed. And we are very strong in faith, first of all. So, I mean, I really believe God's hand has been in the middle of all of it.
Yeah.
And just been carrying us through. My children have such peace. I have 4 babies, 10, 8, 6, and...
Oh, so you're busy.
Yes, very busy. But we do. I mean, that my children have such peace. We just know that I'm going to get through this.
Okay.
And my husband has been strong. He's been with me through it. And, even when we got the diagnosis, I mean, we were not worried. I just knew, okay, this is a journey we're on.
Yep.
We're going to just walk strong in faith. We just know who's in control,
Yep.
and we're just going to keep on going forward.
Well, thank you for sharing your story with us. It's really inspirational. I
Thank
appreciate
you.
it.
And wear your sunscreen.
Yes. We're sitting down here with Aileen, our second cover model, and we want to know a little bit about your story. Do you want to share like maybe how it started from the beginning?
Sure, absolutely. Well, I got diagnosed with Hodgkin's lymphoma in 2010 in September, and I was 5 months pregnant at the time.
Wow.
So pretty horrible.
Yeah.
It was
I would
very
agree.
shocking. I've always been a very healthy person, and everything was going perfect. Life-wise, career-wise, everything was great. So my husband and I decided to have a baby, never imagining what was going to happen.
Of course not.
But I had pain on my upper left rib, and I decided to tell my doctor, and she said, get that checked out because that's not normal. So
Okay.
she sent me to the ER. I was so upset that I was going to the ER. But in the ER, they thought I had a blood clot, and they did a CAT scan.
That's funny. They thought she had a blood clot
Yep.
as well.
Because we were both pregnant, that's
Yeah.
what they think when you're
Okay.
out of breath. I was coughing, I was
Okay.
out of breath, and I had the pain on my rib, which was actually an enlarged spleen. It wasn't my
Oh,
rib.
wow.
So when, like at 3 a.m. in the morning after being there for hours, the doctor comes in with a very horrible face, and I tell him, I don't like your face, doctor. He's like, we didn't find a blood clot, but we found some masses. So I'm like, masses? It's like, I've always been healthy, so I have no idea what he's going to
Yeah.
say. So he said that it could be lymphoma. And at that moment, I'm like, isn't that cancer? He's like, I'm so sorry. I'm like, what? And so I had already been seeing Dr. Gersten for just checking my blood. And
Oh, okay.
So I had already met Dr. Gersten. He was just treating me as a hematologist.
Okay.
Because I have high blood platelets.
Okay.
And pregnant women clot more, so
Okay.
so they wanted to check and monitor. So when they called him at 3 a.m. in the morning from the ER, he couldn't believe it was me because I was healthy. There was no problem. I went to see him the next morning. He was very shocked of the CAT scan results. And after 3 biopsies and a surgery on a lymph node removal, they diagnosed me in September that I had stage 4. It was spread throughout the top half of my body, lungs, spleen, different organs.
Wow.
It was pretty aggressive. So I had chemotherapy, 3 chemotherapies before the baby was born.
Oh, wow.
So that was very shocking. I didn't know they could do that.
Yeah, I didn't know either.
They can, and she was born at 37 weeks. I had a C-section, and she was born perfect, no problem.
Oh, good. Nice and healthy.
Nice and healthy. She was perfect. So by on December 28th, she was born. And I kept going with chemo. I had 6 more months of chemotherapy. I got cancer-free in March, and then finished chemo in May of last year.
Okay, great.
And then in February of this year, I got re-diagnosed.
Oh, wow.
So I was on remission for 9 months. Everything was great. I didn't feel anything. I was just going for a
Yeah.
9-month checkup, and they found a little mass in like the under the rib cage or
Okay.
around the lungs.
They say that it happens often when you have it previously.
It did
and
for me
reoccur.
because I had a lot of disease when they found it. So
Okay.
even after I went on remission, there was a 30 to 40% chance it
Yeah.
could come back.
Oh, okay.
I just refused to think it would, but
Of course.
but it did. So I'm getting chemo again. I started chemo on February 24th again.
Okay.
I have, I think, 2 more treatments, and then I have to go for a stem cell transplant.
Great.
So that's the next step.
How do you feel nowadays with going through everything right now?
It's very overwhelming. I mean, but it humbles you as well. Your
I
life changes
understand.
completely. Before I was
Yeah.
very workaholic, focus. When the baby was born and this happened, it turned everything around. It's like, you know what, you kind of appreciate things a lot better. Your family and
Yeah.
your friends and just where are you going?
I think that's important too. I mean, I don't think, for people that don't have to go through this,
Mm-hmm.
it's important for them to remember that as well, that life is very short and
It is
be
very
grateful for
unpredictable.
everything you have.
Yeah, it is very unpredictable. You would never think. I mean, I was never sick before, so
Yeah.
I would have never thought I was going to be a cancer patient.
And that's what the doctor was saying before, is that this is that age group where it's so not talked about as much as any other age group. So it's good to be aware of what is out there.
Yeah, you don't think that when you're pregnant you're going to go through this, but because of the age group, actually what I have, the Hodgkin's lymphoma, is common on young people, and young people have kids, so it's not that uncommon to have a pregnant patient with what I have. I think that nowadays it's just living a day at a time. Very appreciative. I'm taking advantage of my baby as much as I can because I just want to be with her as much as I can. She's 15 months old, which is a very active time of her life. So when I had chemo and I don't feel well, I try as much as I can to get up and play with her and do these things. But there's the good days and not so good days. So
Well, I think it's important that you're telling your story, and I think that gives awareness to everybody else. So thank you for sharing your story with us.
Thank you.